So they say genes may load the gun, but lifestyle pulls the trigger.
This is the item of gravest danger.
It is capable of damaging nearly every organ of the body system.
We are talking about 6 million people dying every year.
As urbanization shapes our landscapes and globalization changes our lifestyles, faster and faster, second by second, a set of diseases threatens the WHO's Southeast Asia region, home to a quarter of the world's population, causing 3 out of every 5 deaths. They are the world's most common diseases. All countries in the region are facing this threat today. Tobacco use, unhealthy diet, harmful use of alcohol, and inadequate physical activity are the most common risk factors for these diseases.
Tobacco for me is the only consumer product in the world which has got no use whatsoever apart from causing death, disease, and disability.
India, the birthplace of Ayurveda and yoga, also one of the fastest growing economies in the world. This surging growth comes with an unprecedented threat to the health and lives of its 1.2 billion people. One of the leading killers in India is the frequent use of tobacco.
In India, the burden is unique from the point of view that Indians succumb to tobacco-related illnesses and diseases much earlier in life, and which is during their productive years of life. One realizes that health cost due to tobacco is much higher than what a country in terms of tobacco revenue earns.
India has shown strong political will in its fight against tobacco, but millions remain vulnerable to diseases caused by its growing use, from smoking to chewing and multiple other uses such as gutka, pan masala, hookah, and chillam. Tobacco use continues to wreak havoc on the health of generations of Indians. The Government of India, together with NGOs and other stakeholders, is working shoulder to shoulder in this relentless fight against tobacco. It's an uphill task, but the will and resilience of the anti-tobacco warriors remains unshakable.
Tobacco use is a menace, and the Government of India is committed to finishing this. In fact, our commitment is very clear. There has to be a reduction in tobacco use by 30% by 2025. In order to arm ourselves to get to this milestone, we have the Tobacco and Other Products Act 2003, which prohibits smoking in public places, and we are also trying to ensure that people do not get affected by second-hand smoking.
Signs of India's battle against tobacco are visible everywhere. There is widespread proof of the commendable efforts by India against tobacco use.
Initially, we were very apprehensive when this law was being brought in, especially due to the fear of loss of business due to loss of footfalls. But then actually when this got implemented, we were very, very pleasantly surprised to see that our business grew. Actually, this law has not only been just able to replace our regular crowd and bring us more family crowd, but it has also allowed us an opportunity to provide a cleaner environment and a healthier environment to all our patrons, which is a great privilege.
One more thing that the country has done, which is the only country to have done so, is a ban on advertisement of tobacco in film and television. Therefore, there will be no publicity of tobacco and there will be no attempt to lure youth towards tobacco.
Now this awareness campaign before the movies is definitely contributing to a level where at least we are making an attempt, or we are making the children aware of the hazardous things we have been making a habit of, rather than just trying to look cool with.
Besides ensuring the effective implementation of the existing laws, a national tobacco cessation quitline needs to be established to take the fight to the next level. The government is also constantly hiking taxes to make it a less viable business altogether. As the sun seems sure to set on tobacco, a healthier India looks towards getting ready to take its rightful position under the global sun. In the neighborhood is the Kingdom of Thailand. As the land of thousand smiles grows rapidly into an international tourist destination, a serious issue burdens the country. One of the leading killers in Thailand is alcohol abuse, and the number of alcohol drinkers is rapidly increasing.
Alcohol has been embedded to Thai society for 100 years.
Alcohol consumption is the greatest risk factor in Thailand. It leads to not only acute injury and long-term mental health problems, but also communicable diseases. The social costs from alcohol-related problems cost Thai society up to 2% of its GDP, mainly through premature death, loss of productivity, and health expenditures.
Until these 50 years, that alcohol consumption in Thailand has skyrocketed. Particularly those who conventionally don't drink, such as female and our youth.
As problems continue to drown the health of the country, the government and the society remains headstrong in this fight. Drastic measures were put in place to safeguard the Thai people from this menace.
ประเทศไทยนะครับเรามีการรณรงค์นะครับและก็การควบคุมการดื่มเครื่องดื่มแอลกอฮอล์โดยอันดับที่1คือเรื่องของการบังคับใช้กฎหมายนะครับประเด็นแรกคือตรงข้ามกับแรงจูงใจหรือมาร์เก็ตติ้งก็คือห้ามการโฆษณานะครับเรามีเวลาให้โฆษณาตั้งแต่5 โมง AM จนถึง 10 PM นะครับเรื่องของจำกัดการขายนะครับคือบุคคลที่อายุต่ำกว่า 20 ปีซื้อไม่ได้นะครับเวลาที่ขายก็มีจำกัดนะครับประเด็นที่3ก็คือเรื่องของสถานที่ที่ดื่มจำกัดสถานที่ดื่มคือในสถานที่ราชการหรือวัดหรือบนรถยนต์สาธารณะขณะขับต่างๆเนี่ยห้ามดื่ม
ในประเทศไทยจะมีการควบคุมเครื่องดื่มแอลกอฮอล์อย่างจริงจังในระดับหนึ่งแล้วก็ทำให้สามารถบางกลุ่มเนี่ยสามารถลดการดื่มลงได้แต่ก็ยังไม่ใช่กลุ่มที่เราอยากจะให้ลดการดื่มอย่างยิ่งนะครับโดยเฉพาะในกลุ่มเยาวชนหลายคนก็เป็นห่วงเยาวชนที่อยู่ในครอบครัวที่มีการดื่มทำให้เขาได้เห็นการดื่มเป็นประจำเนี่ยก็ทำให้เยาวชนเหล่านั้นกลายมาเป็นนักดื่มด้วยตัวเองแล้วก็มักจะดื่มอย่างอันตรายหรือดื่มอย่างเสี่ยงด้วยโดยเฉพาะในครอบครัวที่มีพ่อแม่ดื่มเนี่ยความรุนแรงในครอบครัวเนี่ยเพิ่มขึ้น 4-8 เท่ากว่าครอบครัวที่ไม่มีการดื่ม
อีกประเด็นหนึ่งคือนอกจากกฎหมายแล้วเนี่ยเราก็มีการรณรงค์นะครับในวันสำคัญทางศาสนาที่ไม่ให้ดื่มสุราดื่มเครื่องดื่มแอลกอฮอล์นะครับแล้วก็มีการรณรงค์อย่างเช่นเรื่องงดเหล้าเข้าพรรษาช่วง3 เดือนนี้นะครับสำหรับในอนาคตนะครับเราก็คงจะมีการรณรงค์เพิ่มขึ้นเพื่อป้องกันเด็กเยาวชนนะครับสตรีซึ่งจะเป็นนักดื่มหน้าใหม่นะครับเช่นเรื่องของการเพิ่มสลากเป็นรูปภาพคำเตือนนะครับแล้วก็อาจจะใช้มาตรการทางภาษีนะครับเพื่อที่จะมาควบคุมนะครับแล้วก็ทำให้การเข้าถึงแอลกอฮอล์เนี่ยยากขึ้น
These measures have brought a new wave of awareness amongst the people, but there is still some way to go. In the meantime, the country stands strong on its commitment, helping the people begin a new, sober and healthier life. Sri Lanka. As the island country leaves behind decades of conflict and moves towards embracing brighter times, a silent killer threatens its people.
Number of persons afflicted by this condition was exponentially growing into becoming a problem. Man always thinks he can make more attractive foods available, make it a commercial entity and entice children and adults. What is lost is very rarely redeemable in this illness, and there is no cure for it.
The country is today facing a number of dietary risks. High consumption of salt, sugar, and low-quality fat is damaging the health and lives of its population.
It's important that people themselves are empowered, and that is why we developed these 8 health targets, so that people can change lifestyle accordingly.
As an NGO, our bounden duty is to popularize what is good for us and what is not good for us. So diet comes top of the list, lack of exercise comes next, and mental stress comes third.
Sri Lanka has shown the world that even with limited resources, it is possible to reduce the burden of NCDs and improve the health of its people.
The Ministry of Health was able to formulate an NCD policy which clearly elaborates about the healthy diet.
In addition to that, there were so many media seminars were conducted to aware the people that why these things are very important in their day-to-day life.
I was able to create few electronic media materials. We used those for us first line communication, mass media, and second line communication we have done through the grassroots level public health system.
There's another policy developed to ensure school children also get a healthy diet, which is known as canteen policy for school children.
Normally our children have got used to get some oily food items. After introducing this project, they have embraced to have these local food items.
In the future, and they are really looking at how to call this, how to get down this food industry, and ask them to really go ahead with what is the minimum quantity of the salt that they really need to process food.
These endeavors have reinforced a health-seeking behavior amongst its people.
We say, go natural, be active, and stay happy.
By transforming political commitment into policies, the vision of a healthy, active Sri Lanka doesn't seem like a dream anymore. Even the Himalayan kingdom of Bhutan, which has been leading with the idea of gross national happiness, is today challenged by non-communicable diseases. Physical inactivity is amongst the leading risk factors for NCDs in Bhutan.
If we are faced with this, epidemiological transition in such a rapid fashion, will we be able to cope with it?
Traditionally, Bhutanese are all like agrarian society, so we did not really have much of a problem in the past.
As the city becomes more busy, people are more into their business, we want to give them some space to take care of their health.
Many government departments in the country are working together towards nurturing a healthier and a happier population.
Our aim is to instill this culture of healthy living. so which actually includes physical activity and promotion of sports within the youth.
By playing sports, it's always a plus point that where you can have where you can be physically fit and out of diseases.
We have a policy which says that all the schools in Bhutan, they are supposed to have mandated hours of physical education in the schools. We have curriculum in place, we have trained teachers there in the schools to carry out health and physical education program. Through education, what we are also trying to do is we try to get both the teachers themselves to live healthy lifestyles, then maybe the neighbor communities, we are trying to bring them on board.
Tani ngache jinchi tangdi te tarelera ngache gi ladius kachi biru tarelera gutsu go bila inru ngache gi tasadi khara ta Sri Lanka gi ogi lobra jimina midala te madamini ngache gi lam chob desu desidi saga gendi ngipchinara di go be saga gendi danzi be go be shinale te tinalo sago di tangfule gi ne chacha bendige te sago di pata puto da nimugo be sago jaketansi chimche se sago di meba bendige te totonga jege 다른 천저로 구축되게 차지 담았습니다니 다 로슈레딩 같이 가라 망가지를 존나 좀 제가 배려 유라 다 존나 좀 제가 배려 다 치주 잡시 빠는데 디날로 마오 털어발 알루팀체스 넘버 나서베 다 사고 조들이 다 한숨에 같이 롭다나래 다 롭다디 포시비 하는 팀체스 사고 볼리 잡시 타 디티라 텔렌 팀진 라체기 볼리 잡시 아니수 가라 소소베 조디게 베베니베 내가 차지 나는 수들이
We find more people wanting to walk, wanting to visit the recreational parks. These are places where people would like to go, spend their weekends, have family picnics. So this is how people love to live a healthy life.
Street by street, effort by effort, Bhutan's vision of a happy and healthy nation is not far from reality.
All countries want to be successful. The measure of that success ultimately is how happy and how healthy their people are. If we in Bhutan are to continue providing free healthcare to all our citizens, if we in Bhutan are to continue reaping the benefits of a successful primary healthcare, we must fight non-communicable diseases.
As Southeast Asia region stands tall to combat non-communicable diseases, with a strong political commitment and support from all sectors of government and all sections of society, we can ensure a healthier future for our people. Together we can, and together we will.